This is the shoulder joint of the right side, and there are 5 ligaments here. First one is capsular ligament. This is the capsular ligament, you can see, and another is coracoacromial ligament, that is originated from the coracoid process and attached to the humerus, and another is transverse ligament. It is attached between the two tubercles of humerus, and another is glenohumeral ligament. It has 3 parts. One is superior, middle and inferior. They are originated from the glenoid, outer border of glenoid cavity and attached to the humerus. And another ligament is glenoidal labrum. It is only in the outer margin of the glenoid cavity. These ligaments helps in the stabilization of the shoulder joint, and there is no capsular ligament in the inferior glenoid tubercle. That is why inferior glenoid tubercle is extra capsular, and superior glenoidal supraglenoid tubercle is intravascular. That is why dislocation of humerus is inferiorly is more common in all peoples. You can see the capsular ligament here. See, this is the capsular ligament which is attached to both glenoid and humeral. See, this is the capsular ligament. This is the unstable joint in the upper extremity because the head of the humerus is bigger than the cavity, glenoid cavity. That's why it is unstable. It is not fit completely into the glenoid cavity. That is why this is the unstable joint in the upper extremity. This is the shoulder joint of the left side, which is ball and socket joint, which is a type of synovial joint. Here we can see the capsular ligament, and there are movements. The first movement is flexion. The flexion is caused by the 2 muscles. One is pectoralis major muscle, which is the clavicular part, and deltoid anterior fibers. This is the deltoid anterior will cause the flexion of the shoulder joint, and next extension of the shoulder joint is caused by 2 muscles. One is deltoid posterior. This is the posterior fibers of deltoid, which is attached to the spine of the scapula, and another muscle is latissimus dorsi, which is attached to the intertubercular sulcus. These 2 muscles cause the extension of shoulder joint, and the adduction of the shoulder joint is mainly done by the 2 muscles. One is pectoralis major muscle, and another is latissimus dorsi. And the next abduction is done by another 2 muscles. That is, one is deltoid, which is medial fibers, and supraspinatus muscle. Here is the supraspinatus muscle it is going downside of the acromial arch and attached to the greater impression of the greater tubercle. These 2 muscles cause the abduction, and the medial rotation is caused by the only one muscle, that is subscapularis. Here you can see the subscapularis, and lateral rotation is done by the deltoid. This is the deltoid. The 2 posterior fibers are causing the lateral rotation of shoulder joint. In the abduction part, there are 3 muscles involving the abduction. One is supraspinatus. It will abduct it is also called the initiation of the abduction of the shoulder joint. It will help in the abduction of the shoulder joint in 0 to 15 degree, and deltoid, that to acromial fibers will help in the abduction of 15 to 90 degree, and above 90 degree is 2 muscles, that is, one is trapezius and serratus anterior muscle. It is abducting the shoulder joint from 90 to above 90 degree.